Hey there, it's Dr. Appelraju again. And how do you reverse cavities? Do you know what a cavity is? Well, decay or a cavity is really an infection of the hard tissues of your teeth, the enamel, and eventually the dentine. And it starts out slowly and progresses. And typically the reason for people having cavities is a combination of factors, some of which we can control and others we cannot control. I'll give you an example. Certainly we can control the type of toothpaste we have, and typically most dentists are going to recommend a fluoridated toothpaste to benefit you as a topical agent. Certainly brushing your teeth on a consistent and regular basis and focusing on certain areas that easily miss, such as the upper back molars around the cheek sides and around the gum of upper front teeth. We find that people often miss these areas. But also flossing is critical in removing debris from between your teeth. It's said that 35% of your tooth surface is between them where they contact, and you can't get your toothbrush there. So it's critical to remove plaque or bacteria from these areas, those bugs that are invading and causing the cavities or the dental decay. So as I said, it's an infection. And how can you limit that? Well, there's certain things. Obvious things would be limiting or cutting back or even eliminating excessive sugar. And it's in various forms. Certainly read labels. The obvious ones would be in the liquid form, such as your soft drinks, your iced teas, your energy drinks, and possibly Gatorade and Powerade, those other seemingly healthy drinks. But certainly look at your coffee consumption and your tea. Are you adding sugar, honey? What are the ingredients that you're putting in these beverages that you consume on a daily basis? And try to cut back slowly. So those are some factors. Certainly the type of saliva you have will factor into protection, and also your surface area of your teeth, the structure. These are things that you can't control. Losing teeth will make you at more risk of decay, especially if things start shifting or drifting or moving or tilting over. You're more inclined to have food impacting in those areas and getting stuck, and more bacteria also makes you high risk for gum disease when these things tend to happen. So it's important to keep your teeth, keep them aligned in a certain way to prevent them from getting food and debris jammed in between. And fluoride toothpaste is one of those simple things that some people could use, but there are some people that need more than that. And there are professionally prescribed mouth rinses and agents, topical agents, that can be used in trays or in your toothbrush to help minimize the chance that you get cavities progressing. Now, typically in our office, if the cavity is quite small, it doesn't mean it's going to go away. Just magically, it will tend to progress over time. So we encourage our patients to floss or focus on those areas and use some adjuncts to help minimize the decay spreading. So can you reverse decay? It is possible, but it does require some time and effort and energy and focus to keep diet under control, and home care improvement needs to be significant to focus on that, because slowly over time the decay will get worse. And once the infection or the cavity gets through the enamel, then it has to be restored by a dentist, has to be filled, because no matter what you do after that, it will tend to progress. And if you leave it long enough, that's when we end up with large toothaches and broken teeth and either extraction or root canal therapy. So that's a much more dramatic change than from filling or preventative measures, as I mentioned earlier. So it's in your best interest, floss, brush, and mouth rinse if you need to, fluoride toothpaste on a regular basis. And it's also critical that once you do that in the evening, you don't jump into bed and start having snacks and sweets and then go to sleep. That's the worst thing you can do. So it's really important that once you finish brushing your teeth and flossing and mouth rinsing and all that sort of stuff in the evening, you don't consume anything other than water. So don't eat anything while you're in bed watching your Netflix, because that stuff will definitely make you high risk for cavities. All right, I hope you found that useful. Take care, and I'll see you soon. Remember, you have one life. Live it well.